Hey guys, hey, karibuni sana, welcome back to my YouTube channel. It's your girl here, Bokenana. It's your girl, karibuni sana. Hey. Some people tease me with how I say that. Hey, they greet me that way nowadays. Hey. So karibuni sana to my YouTube channel. I've missed you. Nimewa miss. It's been a minute, guys. I've not posted, but here I am. Karibuni. Welcome very much to my YouTube channel. Feel at home, guys. And yeah, today we're going to do something different. As if I've been doing everything. We're just going to be doing something different one. Yeah, I'm in scrubs. A scrub, so you just know it's a health talk, a simple but something that's happening in our society topic. Yeah, and I'm hoping you're going to learn one or two things. You're going to have clarity over some few issues, and yes, take a pen, take a paper. Class is in session right now. I think me subscribe. Una dadonjo class yangu. Una enjoy class yangu ya bure. Ebu subscribe. Road to 250. Mnaniachaje kwa matach 98 subscribers. Hebu subscribe wewe. Views ni nyingi kuliko subscribers now. Hiyo tufanye hapa. Subscribe. So without wasting much time, let's get into it. To hit mkisi. Kisi jaman. Let's get into it. So today we're discussing about HIV, most things about HIV, and at the end of this session we're going to have a short question and answer segment. Yes, let me say that. So I have some notes here with me. I prepared myself. Don't worry how dedicated I am. Nafu mnakosa kusubscribe. Msinifanyie hivyo, you're bad. So yeah, to start, we're going to define HIV. HIV on itself is an abbreviation, meaning human immunodeficiency virus. Human immunodeficiency virus. This is a virus that weakens your body immune system, especially your T helper cells. Especially your T helper cells, as I was saying. So if it weakens your body immune system, there are things that your body can't do. You'll be at risk of getting various infections. Yani utakuwa too weak as a person. You're weak on this street. Hamkudungwa BCG. That's aside. So, mode of transmission of this HIV. HIV is transmitted through body fluids. These body fluids include semen, include blood, include vaginal fluids, and also it includes your breast milk, not your women's breast milk, for those who are breastfeeding. Yeah? So, it can also be transmitted through direct contact with an infected person, damaged tissues, and mucous membrane. What am I saying? I'll give you a short example. If a mother is pregnant, gives birth to a kid, and during breastfeeding, which babies do exclusively up to 6 months, this mother hakunywi dawa or anything, she's breastfeeding this baby definitely. So the HIV virus, the virus itself, can be transmitted from the mother to the child when the mother is breastfeeding the baby. So that's one of the modes of transmission of HIV. Let's say blood. You've heard of these people who wanajidunganga those drugs and everything. Definitely kutakuwa na some essence of blood kwa hiyo syringe ama needle, and when they share it with another person, that person is going to be infected with HIV. The same way, me as a healthcare profession, I'm a nurse, I have a cut and then I don't wear gloves. I go do a procedure on this patient, even drawing samples, blood samples on a patient, then that blood comes into contact with the cut that I have. Mind you, I'm not wearing any gloves. I'll be at risk Why? That blood can come into contact with that cut, and through that cut it can enter my body, yeah, and it can get easily infected. Ama the same way needle pricks, which happen occasionally, ama frequently, as a mistake in hospital. I can go prick a patient and I don't know their status. So you see, if I prick that patient, then me mwenyewe nikuje nijidunge, maybe when I'm disposing it off, I can get infected like that. Naanza kukunywa hapa pep and everything. So yeah, those are just simple ways of which uh this thing is going to be transmitted through sex. That's through the semen and vaginal fluids. It's just a simple way to show you that, guys, when they don't use any protection, that's a barrier of them coming into contact with that person who's infected. Yeah, hivyo tu mtu anapata HIV. It's very, very simple. So sorry, HIV is not spread through tears, saliva, and sharing hands. Yes, HIV cannot be spread through those ways. So mtu akikusalimia and they're HIV positive, si kama zamani where they was facing stigma and everything. Ukishajulikana ule akona HIV, you can uko unasalimiwa, your cups zilikuwa disposed, your plates are disposed, whatever you touch is cleaned. Tumetoka mbali as a nation, as people. So HIV cannot be transmitted through such modes. Yeah. So how do you know you are HIV positive? There's just one way to know. That's getting tested. Yes, testing of of you as a person, of you as a couple, just ensures like if you are HIV positive or negative. That's the only way to know if you're infected or not. So what are the symptoms of this HIV class? Ebu jibu. Yeah, there's just I'll just share a few examples of how you'll know you're infected. Number 1, flu-like symptoms. Watu wakahoma hapa na pale. It can be fever, you can have chills, you can have fatigue, swollen lymph nodes, and this can happen after 2 to 4 weeks from the day you are infected with the virus. This is just some of the symptoms, but the definitive criteria of you to know you're HIV positive, just get tested. When was the last time, guys, ulikuwa tested? When was the last time you were tested? When was the last time you were tested? You can be a carrier and you don't know. Yes. But as we all know, HIV, most people are asymptomatic. Asymptomatic means they can't show the signs and symptoms of you having the HIV, and they can go around spreading the HIV with them not knowing they have it. Okay? So you can be asymptomatic. Si lazima uonyeshane the signs and symptoms. Lakini Nairobi, Sodom and gonorrhea. Just be safe. So sex can be transmitted. HIV can be transmitted when through sex. Yes, that's the common, the most, at a high percentage of the modes of which HIV is transmitted. Number 1, sex, through sex. People out here are not using condoms. People out here are just engaging with multiple partners in this activity, making them prone to transmit and also to be infected with HIV. Sharing injections in hospitals, for example. Kids in hospital, for example, we have this policy of 1 injection 1 patient. Siwezi tumia needle moja nijidunge then I go dunga another patient. That can't happen. It cannot. If I'm using the injection with me myself, I'll use it me peke yangu. If I'm using it to patient A, I can't go and use it again to patient B. Yeah, so sharing injections can also happen with this drug addicts who inject themselves with the same needle, anajidunga dawa, then the same needle, and inject another person, then another person, they continue sharing the same needle and everything. If one of them is infected, definitely is going to transmit that HIV to another person. Uh-huh. It can also be transmitted with those people who do commercial sex. They do sex for money. Yeah, definitely. And they do it with multiple partners. Na si kila mtu atatumia the condoms and everything. And men to men. Yes, sina maoni. Sina maoni. So how can you be tested for HIV? Testing for HIV is done in two ways. That's through the oral swab and also the blood sample. I think most of you guys have seen the blood sample where just you're pricked with a small needle, then munaweka kwa kale kakitu munaitesti hapo. Then if it's positive, you'll see, and if you're negative, you'll also see that. With the swab, oral swab, there's a thing you use to through your mucosa, unafungua mdomo. You rub it through your mucosa, and yeah, after that unairudisha kwa that kasashe and everything. Then you'll just see after 20 minutes if you're positive or negative. So how do you reduce the risk for HIV and AIDS? Number one, we've said like wale watu wako more prone to get this are those to get HIV are those who engage in sex. So one of the way to reduce the risk of the spread of HIV is through the use of condoms. Condomize. Wrap it. Wrap it before you tap. Okay? Use condoms because you never know who's infected or not. Just use a condom. Yes. You discuss any drug use before sex. This is specifically for those people who use naitwaje sindano for drugs. So before you do anything, just ask them. Do you use injectable drugs? Yeah, just ask, because communication is the key to everything. Not really the key to everything, but it's the key. Yeah. So when I communicate, just ask the partner like, umekuwa ukitumia this and this. Yeah, just ask. Yeah, another way is avoid sharing needles. That's applicable to healthcare professionals and those who are drug users. Avoid sharing needles. Yes. So up to there we've discussed about the definition of HIV, how it's transmitted, uh, the testing mechanisms, that's through the oral swab and also through the blood samples, and we've also talked about how to reduce the risk of spread of HIV. Toyamwe, we're together. Let's take a break. Now subscribe. Now pay 1 minute to subscribe. As I, appreciate myself. Subscribe. I subscribe. Have you? Have you? Yeah, we're going through the second last segment. That's the drugs which are used for HIV. In HIV kuna PrEP na kuna PEP. PrEP and PEP. PrEP means pre-exposure prophylaxis. Pre-exposure prophylaxis, meaning this is just an HIV negative person taking precaution because ako with a high risk of getting the HIV. For example, if there are many commercial sex workers around, with them they can't use the PEP unless they are infected, but they can use the PrEP, pre-exposure prophylaxis. A prophylaxis is just a mechanism ya to prevent something to happen. Okay, so if they're using pre-exposure prophylaxis, that's the PrEP, they are preventing themselves from getting the HIV. That means they are HIV negative. We're together. Another type is the post-exposure prophylaxis. The PEP, post-exposure prophylaxis. Post-exposure. The other one was PrEP, which is pre-exposure, which is given to HIV negative people who are at a high risk of acquiring the HIV. Post-exposure prophylaxis is given to those people who have been exposed to HIV infected people. For example, those people who are raped and they don't know the status of those persons who have raped them, they are given PEP. If you engage in sex without use of condom and you don't know the status of the other person, you are supposed to take PEP. PEP, 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 post exposure prophylaxis. That's when you're supposed to take PEP. And it's also to be used within 72-hour window. You can't use it after 72 hours. Yeah, for its efficacy, for it to be efficient and for it to, work in your body, you're supposed to take it within 72 hours after exposure. We're good? Tuko sawa? So prep, I'll recap on that. Ndege utawala kuishi kwa randu. Pre-exposure prophylaxis, that's the PrEP, is given to HIV negative people who are at a high risk of acquiring the HIV. PEP is given to those people who are already exposed directly or indirectly to those people who have HIV. That's simple like that. So, and it's for PEP, it's to be given within 72 hours. Tuko sawa? Yeah, I've heard of this story where yaitwaje, this guy was told this story. This guy X, went is in a long distance relationship with a girl. So once the guy is back, he didn't know like the girl had HIV, had acquired HIV kwa hiyo period alikuwa away. So when he came back, they engaged definitely, and without condom. Oh, in sex without condom. And the lady told the guy she's positive. And the guy is like, why didn't you tell me? But did he ask? No, I'm not saying it's the right thing to do, but did he ask? That's why I'm saying, like, communicate and just test. Test. Before everything, just test. Test before you engage in any sexual activity with a guy or with a woman. Just test yourselves. It only takes a miai bwana, hata kama ni joto. Relax, cool down. Yeah, and we're done. So with the last segment, I'm going to plug you guys with where you can get the oral swab for you guys to test, and I'm also going to do a small myth or fact segment with you guys. The first question is, can a HIV positive individual safely conceive and have children? Can a HIV individual, that is specifically the mother, safely conceive and have children? What do you think? Is it a yes or a no? Yes, the answer is a yes. The mother can safely conceive and have children if they take their medication well. Excuse me. When they're during pregnancy, they're supposed to take their medication diligently, and after delivery they're supposed to continue taking the medication until the time wataacha ku breastfeed. Then there are other measures which are taken from there. Okay, so that's a yes. Question 2, can one tell if someone has HIV by looking at them? Nimekupima we hauna. Venye umekonda ama venye umenaona, uko nayo, uko na HIV. Can you do that? You can't. You cannot. You cannot measure the status of a person with just looking. Unaangalia unasema hii homa na hii joto, uko na HIV, uko na, you are positive. You can't do that. The correct way to know if a person is HIV positive is just through testing. We're good. Question 3. Can you get HIV from sharing water and food? Guys, essentially mpaka sasa hivi you cannot. That's simple as that. Number 4. HIV has a cure. Is that a myth or a fact? HIV has a cure. No guys, HIV has no cure as for now, but studies are still ongoing. Yeah, just taking your medication and everything diligently can reduce your viral load, and with that you can reduce the risk of transferring your virus to another person. simple as that. HIV has no cure, but medication can slow down the progression. By slowing down the progression, you mean you cannot. So honestly, stages do window stage tunakumbuka. Yeah, those stages, you can just slow the progression of the disease by mainly reducing the viral load of a person, adding to that unnoticeable, level. Because unaona, someone can be a carrier, by the way, someone can be a carrier, and when you test them itakuja negative. That's that imanishi ya kwamba you not condomize regardless of anything. They can be a carrier, they can be diligently taking their medicine, and the viral load is unnoticeable hata with treatment, na unaenda hapo unajieka at risk wewe. You condomize. Yeah. So number 5, this is a fact, which will in fact, this is a research that was done in 2022, that 5 million did not know 5 million people in the world did not know they were living with HIV in 2022. So guys, do you know your status? Are you positive or are you negative? Early detection can lead to better prevention measures, and you can prolong your life through that. So, oh, sorry guys, interruption kidogo. As I was saying, people don't know their status around, so get tested. Ensure you're tested before engaging in any sexual practice with your partner. Yeah, and you can just do it on your own, because kama healthcare profession, you're at high risk of contacting this, so just get tested. We have the Aura Quick Self Test Africa. Aura Quick Self Test Africa. Just follow their page on Instagram. Yeah, and they have a website where you can purchase their test kits. Yes, it's really affordable, guys. You can just do it on your home, at the comfort of your home. Yes, order it, do it at home. It's just a swab where you just swab from your mucosa on your mouth, and you test it on your own or with your partner. Why, guys? Get tested, stay safe, and know your status, guys. Nawapenda sana. Let's meet again for another segment of Health Talks with me, Health Talk 101. And ensure you subscribe, you like, you share, you comment. I'll be back again next week with another video. Hopefully it will be maybe a healthcare segment or anything else, but either way, make sure you subscribe. Road to 250 subscribers. Watu wakwenu wamesubscribe, kwetu wamesubscribe, na kwenu hebu subscribe. Wacha guys, subscribe, wacha kudojo video zangu for free. Subscribe guys, and yeah, let's meet again next time. Nawapenda.